Welcome to section 11.1 of genetics. In this section, we will be memorizing the details of Turner syndrome. So let's get started. This story takes place in a mythical forest. As you can see, there is a scared little hobbit-like character. If you thought he was just standing alone in the forest, you were wrong. He's actually hanging there all alone in the forest. This canopy of spiderwebs represents the lymphatic system. These little bumps on the webs represent lymph nodes. Turner's patients often have lymphatic blockage, frequently in the neck region, resulting in cystic hygroma, a fluid-filled neck bulge. So the webbing around the neck should help you remember patients have webbed necks. The webbing itself should help you remember lymphatic blockage. Notice this guy's large hands and feet. I guess this hobbit-like character was chosen appropriately. This will help you remember that lymphatic blockage can result in lymphedema, or swelling of the hands and feet. Now let's bring in our human hero. Look as he comes riding in on his stunning horse. His weapon of choice is a sling. As he turns it around quickly through the air, it looks like a T. T for Turner's, so it's turning. So again, this is Turner syndrome. Now notice this arching tree here that our warrior is approaching. This is shaped like the aortic arch. At the base on the left is the trunk of the tree. Notice that it is split in two. This is to help remind you that Turner syndrome patients often have bicuspid aortic valves instead of the normal three cusps of their aortic valve. At the top of the arching tree, there are branches coming off. Then we can see this little tiny spot right here. This is to remind you of aortic coarctation, which is often present in Turner's patients. When it comes to symptoms of aortic coarctation, use some simple logic to deduce them. If there is a stricture reducing blood flow to the lower extremities, it makes sense that blood pressure, or even pulse pressure, would be lower in the legs. If blood is building up proximal to the blockage, then the arms would receive higher pressures, which means the upper extremities would have a higher blood pressure or pulse pressure. So if you get a question about a patient with higher blood pressure in the upper extremities and lower blood pressure in the lower extremities, you should consider Turner syndrome and aortic coarctation. Now that we've discussed this aortic tree here, let's bring in the villain, the big bad spider. This beautiful horse hits this giant spider with its head, knocking it against this aortic tree, really close to this aortic coarctation actually. Now just to clarify, the spider in this image isn't used to symbolize anything. The value in this giant spider is to be awesome looking and to be an excellent villain to help tie together this whole image, especially the webs in the back and a few other items we will discuss shortly. Here is another hobbit-like creature. He's obviously freaked out by the spider, though lucky enough not to have fallen victim to its webs like the other guy. This little guy will help you remember the short stature in Turner syndrome patients. And once again, he has big puffy hands and feet, which will help reinforce the idea of lymphedema of the hands and feet, which we discussed before. It looks like our hero arrived just in time because this little guy was oblivious to the spider which was about to strike him. He was too distracted by his compelling game of tic-tac-toe. Notice that an X and an O are all that have been etched into the game so far. This is to remind you that Turner's patients have a 45XO genotype. Normally, there are 2 X chromosomes in females, contributing to the total number of 46 chromosomes. With 1 X chromosome absent, signified by the O, that means these females have only 45 chromosomes. So XO in tic-tac-toe, 45XO genotype. Now look back here at these spider eggs. It looks like they got all smashed up. This is to help you remember that there is ovarian dysgenesis in Turner's patients, so their ovaries lack the ability to put out healthy eggs. If you can remember that ovaries are dysfunctional, you can deduce some additional findings which are very intuitive. Now this is an image of a tertiary follicle within an ovary, which is discussed in detail within the reproductive physiology chapter. Right now I want to draw your attention to the granulosa cells and the theca interna cells. The granulosa cells, indicated by this box, normally produce estrogen, and they are stimulated by FSH. If estrogen is low, then the anterior pituitary gland will release more FSH in an attempt to increase estrogen. The box on the right represents theca interna cells, which produce the androgens with which the granulosa cells produce estrogen. Again, if estrogen is low, the anterior pituitary will increase LH in order to aid the production of estrogen, so LH will be high. So if ovaries are dysfunctional, deduce that estrogen is low and LH and FSH are high. Now notice this eggy goo leading away from the nest. It's almost as if someone stomped on the eggs and then walked away. Sure enough, this little guy smashed those eggs. Naturally, he is scared. He knows he did something to really upset the spider. He is even ready to shield his chest from attack. This shield over his chest will help you remember that Turner syndrome patients often have a shield-shaped chest. This just means their nipples are widely spaced and their chest is broad. Finally, look at the patch of kidney beans that this horse galloped through. And now look at these nice horseshoes. These nice horseshoes in the kidney beans will help you remember that Turner's patients often have a horseshoe-shaped kidney. You may have also noticed that the road in which our 2 hobbit-like characters are sitting is also shaped like a horseshoe. This will just further reinforce this concept. And with horseshoe kidneys, we have concluded our image mnemonic on Turner syndrome.